Today, we will talk about telemedicine and electronic health records. This paper aims to develop a telehealth success model and discusses three critical components: health information quality, electronic health record system quality, and telehealth service quality to ensure effective telehealth service delivery, reduce professional burnout, and enhance access to care. The paper applied a policy analysis method and discussed telehealth applications in rural health, mental health, and veterans' health services. The results pointed out the fact that although telehealth paired with semantic and organizational interoperability facilitates value-based and team-based care, challenges remain to enhance user, both patients and clinicians, experience and satisfaction. The conclusion indicates that approaches at systemic and physician levels are needed to reduce disparities in health technology adoption and improve access to telehealth care. Keywords: electronic health records, telehealth, telemental health, pandemic, health outcomes, health policy. Rural health services. Approximately 80% of rural areas in the United States are classified as medically underserved and in health professional shortage areas. These regions are lacking the physicians, registered nurses, and behavioral health providers, including psychiatrists, psychologists, and therapists. The patient-to-primary care physician ratio in rural areas is only 39.8 physicians per 100,000 people, compared to 53.3 in urban areas. The shortage disproportionately impacts rural residents who tend to be older, have lower socioeconomic status, are more reliant on public insurance, and have worse health outcomes. For rural residents, telehealth care increased access to experienced providers and high-quality care, improved continuity of care and health outcomes, and reduced health disparities. Studies have shown that greater adoption of telehealth was associated with facilities in rural locations. Between 2010 and 2017, telehealth visits have increased among rural Medicare beneficiaries, with a 425% increase for telemental health services. Telemental health services. There are two primary uses for telemental health: provider consultations with mental health specialists in primary care and emergency department settings, and the direct provision of mental health services, including home-based services. Patient-centered care. A telehealth program, paired with the right EHR system, can serve as a care collaboration platform and help optimize team-based care delivery. It connects off-site specialists in the fields of cardiology, psychiatry and behavioral health, oncology, and infectious disease with patients at home or intensive care units, ICUs. Physicians can easily access and send health records from one interface to another, mobile, computer, or tablet, remotely using a protected account to diagnose and assess symptoms as an in-person consultation. Telehealth interventions, particularly remote monitoring and SMS text messaging, or associated improvements in obstetric outcomes, perinatal smoking cessation, breastfeeding, and schedule optimization for high-risk obstetrics. Population health management. An EHR system with organizational interoperability allows institutions to aggregate community-level data from disparate sources to track influenza and disease trends for population health. For example, CMS requires hospitals to electronically report public health data such as syndromic surveillance data, electronic case reporting, reportable laboratory results, and more. Sharing critical data among healthcare systems, especially during a pandemic, assists public health authorities to predict clusters of outbreaks and make timely and efficient guidance for quarantine and better containment. The COVID-19 pandemic in the United States is affecting different areas at different times and levels. Cases spike in some states, while others face the threats of both COVID-19 resurgence and seasonal flu. Many hospitals are providing a combination of traditional in-person visits and telehealth services that allow remote virtual consultations to patients. Early in March 2020, CMS modified policies to lift originating site restrictions and expand the type of visits allowed virtually. However, after the pandemic, hospitals may shift telehealth services from urgent care and COVID-19 screenings and treatment to regular care visits. It is unclear how current more flexible regulation and payment arrangements will change. Will there be permanent policies to reimburse virtual care and remote monitoring devices? Will telehealth reimbursement rates be set at the same level with in-person visits? Will there be financial incentives to provide reliable broadband access to rural or small hospitals? With hospitals and the healthcare system faced with uncertainties about the duration of this pandemic and the structure of future telehealth benefits, the development of clear regulatory requirements and timetables could help reduce administrative and technological constraints associated with virtual healthcare delivery and encourage further investment in healthcare information technology infrastructure. The COVID-19 pandemic has created substantial financial difficulties for both hospitals and the health system. As a result of canceled elective surgeries and non-essential medical procedures, which often generate more revenues than ICU and emergency care, U.S. hospitals continue to experience substantial losses in revenue. Expenses also have increased sharply from purchasing needed for personal protective equipment, COVID-19 associated hospitalizations, and providing additional support to frontline health workers. Although most hospitals in the United States have adopted interoperable EHR systems, there is little evidence about whether small, rural, and safety net hospitals are keeping up. Compared to more technologically advanced hospitals, smaller and rural hospitals have limited broadband access, less interoperability and healthcare management experience, and staff with less technological familiarity. Because of the uneven adoption of telemedicine services, some small clinics and post-acute care facilities are unable to receive or share patient data. Studies suggest that telehealth programs paired with the right EHR system enhance care access, increase patient satisfaction, and reduce medical spending. And by improving clinician experience, the integrated system can contribute to achieving the quadruple aim. To help integrate telehealth into clinical practice and improve patient care on a systemic level, health policies should accelerate the uptake of telehealth, including telemental health, to improve care quality, cost-effectiveness, and value of care. Federal and state governments can use disruptive reimbursement and funding strategies on training primary and mental health care providers, workforce, licensure, and cultural sensitivity for long-term telehealth practice. Regulators also need to assess and set standards for malpractice liability and protect patient safety and confidentiality that may result from telehealth deployment. On an industry and organization level, hospitals need to identify strategies to adopt and integrate different types of telehealth services and evaluate telehealth products for healthcare delivery. Future studies are needed to provide evidence on telehealth practice guidelines and service models. On a physician level, clinicians who provide telehealth should offer the same level of care and follow the same treatment guidelines that would follow for in-person visits. Moreover, physicians should closely follow HIPAA rules, state laws, and medical board definitions to ensure their practices are compliant with applicable regulations while implementing telehealth. What do you think of our video? Let me know in the comment section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.